Hello, everyone over 60. I'm Mary, and I've been practicing medicine for 8 years. Every day, I see many seniors struggling with prostate issues in my clinic. Today, I want to share a heartfelt message with you. Many people think that frequent urination and waking up at night are normal with age, but that's simply not true. I've seen countless seniors neglecting small daily habits, ultimately turning minor issues into major problems, even requiring surgery. But there are also many who, simply by adjusting their lifestyle, have achieved prostate function in their 60 seconds and 70 seconds that is comparable to that of their 50 seconds, allowing them to sleep through the night and urinate smoothly. Today, I'll explain the 10 most harmful daily habits for the prostate. The first habit is the most dangerous, and almost half of seniors engage in it without realizing it. I'm not trying to alarm you, but rather to provide a healthy approach that's both understandable and practical. After reading this, you'll learn how to naturally protect your prostate and prevent further enlargement. Please read to the end and share this information with your friends over 60. This knowledge may really transform their quality of life in their later years. Let's begin now by looking at 10 habits that silently harm your prostate, starting with number 10. Habit 10: deliberately skipping water and ignoring thirst. A while ago, a 66-year-old man named Jang to my clinic. He said, "Mary, I only drink 2 glasses of water a day now, one in the morning and one in the evening, to avoid the hassle of going to the bathroom during the day and getting up at night." I immediately told him, "You're harming your prostate." Many older adults believe that drinking less water means fewer bathroom breaks. But did you know chronic water deprivation and dehydration can be more damaging to your prostate than you realize? Our urine contains metabolic waste products like uric acid and urea. When you drink less water, your urine becomes concentrated, and the concentration of these waste products increases. Just like when a glass of light salt water becomes concentrated salt water, its irritation increases significantly. The prostate is located directly below the bladder, acting like a neighbor of the bladder. Concentrated urine constantly irritates the bladder lining, which can be directly transmitted to the prostate, leading to chronic prostate inflammation over time. Clinical data shows that men who consistently drink less than 1,500 ml of water daily have a 40% higher risk of benign prostatic hyperplasia (BPH) than those who drink a normal amount of water. Furthermore, many people over 60 take antihypertensive and anti-diabetic medications, which can cause fluid loss. Drinking less water can worsen dehydration, hindering the elimination of toxins and further burdening the urinary system, making it difficult to prevent prostate enlargement. The solution is actually quite simple. Instead of drinking a large glass of water all at once, drink small, frequent doses. Drink 1 glass, about 200 ml upon waking, another at 10 o'clock a.m., another at 3 o'clock and another before dinner. A total of 1,500 to 1,000 ml per day is sufficient. Even if you don't feel thirsty, drink proactively to determine if you're hydrated. Look at the color of your urine. If it's clear or light yellow, you're drinking enough water. If it's dark yellow, you need to drink more water immediately. Don't avoid water just because you're afraid of going to the bathroom. Water is the prostate's natural protector. Drink it right, and your prostate will feel comfortable. Habit 9: sitting for long term. Mary, since I retired, I love to sit on the sofa and watch TV. Sometimes I can watch for 3 or 4 hours without even wanting to move. This is one of the most common things I hear in my clinic. But did you know, sitting for long periods of time can cause damage to the prostate, like chronic pressure, which accumulates bit by bit. Our pelvic region is home to numerous blood vessels, and the prostate relies entirely on these vessels for blood supply. When you sit for long periods, the pelvic region is constantly compressed, acting like a brake on the blood vessels. Blood flow is restricted, and the prostate suffers from a lack of oxygen and nutrients. Over time, poor blood flow can trigger chronic inflammation, which is the catalyst for benign prostatic hyperplasia, a BP, will gradually dry out and crack due to chronic water shortages. The prostate's function will gradually decline due to chronic blood supply deprivation, leading to hyperplasia. I once had a patient, 67-year-old Mr. Lee, who after retirement spent 5 or 6 hours sitting at home playing Mahjong daily. He later developed intermittent urination and woke up 3 or 4 times a night. Examination revealed that his prostate had grown to 1.8 times its normal size and was mildly inflamed. I instructed him to get up and move around every 30 minutes of sitting. A week later, he came back for a follow-up and said, "I've gotten up less frequently and my urine flow has improved." Actually, you don't need to do any complicated exercises. A simple 30 minutes and up routine is all you need, whether you're watching TV, reading the newspaper, or playing chess. After sitting for 30 minutes, stand up and walk a few steps. Walk around your house 5 or 6 times, or put your hands on your hips and slowly rotate your waist 2 or 3 times. Then do 5 lever exercises. Contract your anus as if you're holding back urination. Hold for 3 seconds, then relax. This will promote pelvic blood circulation and relieve the prostate. Don't let a comfortable sitting posture become a burden on your prostate. Moving more now will reduce suffering in the future. Habitate drinking multiple cups of coffee or strong tea daily. Caffeine is essential. A cup of coffee in the morning to wake you up. A cup of strong tea in the afternoon to soothe fatigue. Many older people have this habit. However, if you drink too many caffeinated drinks throughout the day, your prostate can become overwhelmed. Caffeine has particularly unfavorable side effects for the prostate. First, it's a diuretic, causing the kidneys to produce more urine, forcing the bladder to work more frequently. After age 60, the bladder muscles don't contract as well as they did in youth, and frequent contractions can fatigue the muscles, even leading to. Second, tighten the muscles at the bladder neck, effectively locking the bladder shut. This leads to incomplete urination, leaving some urine in the bladder called residual urine. This residual urine can continuously irritate the prostate, like boiling a frog in warm water, slowly causing inflammation and worsening benign prostatic hyperplasia. A 70-year-old patient named Xiao in my clinic drinks 3 cups of strong coffee daily, 1 each in the morning, mid-afternoon, and afternoon. He says, "I feel tired without it," but he also struggles with frequent urination, requiring more than 10 trips to the bathroom during the day and 4 or 5 times at night. I asked him to replace his afternoon coffee with decaffeinated herbal teas, such as chrysanthemum tea or tangerine peel tea. After 2 weeks, he told me, "I've gone to the bathroom 3 times less during the day and only twice at night." It's not that you shouldn't drink, but you should limit your intake to 1 cup of coffee or strong tea per day, and try to do so in the morning. Avoid the afternoon intake. If you do want to drink something, choose decaffeinated options. Think warm water, light honey water, or mild herbal teas, which quench your thirst without irritating the prostate. While enjoying life, we should also leave some space for our prostate. Small adjustments can reduce significant problems. Habit 7. Insisting on spicy food and eating processed food. Can't live without spicy food is a common dietary habit among many older adults. They might enjoy spicy noodles in oil for breakfast, stir-fry fried pork with chili peppers for lunch, and mix vegetables with chili sauce for dinner. Some also indulge in processed foods like canned food, sausages, and frozen dumplings. But did you know these foods are secretly irritating your prostate? First, let's talk about spicy foods. The capsaicin in chili peppers, Sichuan peppercorns, and hot sauce triggers an inflammatory response in the body. While you might feel your mouth and stomach burning when you eat spicy food, your prostate is also heating up. Eating spicy food occasionally is fine, but if you do it daily, the prostate will remain in a state of chronic inflammation. This inflammation constantly irritates the prostate tissue, causing it to gradually enlarge. Clinical observations have found that men who regularly consume spicy food experience benign prostatic hyperplasia 20% faster than those who eat a lighter diet. Also, consider processed foods. Canned meat, sausage, and bacon are high in preservatives, salt, and trans fats. High salt levels can cause edema and increase the burden on the urinary system. Trans fats can disrupt hormonal balance, particularly testosterone, a key hormone that influences prostate health. A distorted hormone profile can easily lead to prostate problems. Frozen dumplings on fast-food meals are also high in fat, and consuming them excessively can lead to weight gain. Obesity itself is a high-risk factor for benign prostatic hyperplasia. My advice to everyone is eat spicy food no more than twice a week and avoid overly spicy foods each time. Try replacing processed foods with fresh ingredients. For example, swap canned meat for fresh chicken or fish, and frozen dumplings for homemade vegetable and pork dumplings. Eat more dark green vegetables like spinach and broccoli, and berries like blueberries and strawberries. The anti-inflammatory properties in these foods can protect the prostate. A healthy diet isn't about being tasteless, but about making our meals comfortable and healthy, which can also reduce prostate distress. Habit 6. Frequently holding urine. Going to the restroom only when I can't hold it anymore. Mary, sometimes when I'm walking in the park and can't find a restroom, I just hold it. At night, I also hold it in on purpose because I don't want to get up. This is a common situation for many older adults, but the harm that holding urine can do to the prostate shouldn't be ignored. Our bladder is like a balloon. Normally, it's empty. Holding urine is like inflating it. The longer you hold it, the more it expands and the greater the pressure. The prostate is located just below the bladder, and bladder pressure is directly transmitted to the prostate, like compressing a spring. Long-term pressure can cause congestion and swelling of the prostate tissue, gradually leading to inflammation and even benign prostatic hyperplasia. Even more dangerously, after age 60, the muscles that control urination, called the urethral sphincter, weaken. Holding urine further fatigues these muscles and can even result in incomplete urination. Residual urine in the bladder can easily breed bacteria, leading to a urinary tract infection (UTI), which in turn can affect the prostate and worsen inflammation. I previously had a patient, 16-year-old uncle's son, who developed a urinary tract infection from holding urine, which in turn led to acute prostatitis. The pain was so severe that he couldn't urinate at all, and he ultimately had to have a urinary catheter, which was a real pain. The key to protecting the prostate is not to hold urine as soon as you feel the urge to urinate. Go to the bathroom immediately, even if you have to get up at night. If you're worried about getting up at night disrupting your sleep, drink less water an hour before bed and empty your bladder before bed to reduce the frequency of urinary urges. The bladder and prostate are good neighbors. If one is wronged, the other will also feel uncomfortable. Only by following your body's signals and not holding your urine can you protect them. Habit 5. Smoking or chronic exposure to secondhand smoke. If you were to rank the habit most damaging to the prostate, smoking would undoubtedly be in the top 3. Whether you smoke directly or are exposed to secondhand smoke for a long time, both can cause devastating damage to the prostate. Cigarettes contain thousands of harmful substances, such as nicotine, tar, and carbon monoxide. These substances do 3 things. First, nicotine constricts blood vessels, reducing blood supply to the prostate, effectively starving the prostate of its nutrient. Over time, prostate tissue gradually suffers from oxygen and blood deprivation, impairing its ability to repair itself. Second part, rigorous oxidative stress, like a dirty trick, damaging prostate cells and leading to inflammation. Third, these harmful substances also increase the risk of prostate cancer. Clinical data shows that long-term smokers have a 50% higher risk of prostate cancer than non-smokers, and the longer they smoke, the higher the risk. Even if you don't smoke, long-term exposure to secondhand smoke is equally dangerous. The concentration of harmful substances in secondhand smoke can sometimes be even higher than first-hand smoke, and it can also harm the prostate. I have a 66-year-old patient, Uncle Zhu. He doesn't smoke, but his wife smokes, and the house is filled with smoke every day. He later developed symptoms of frequent undurgent urination, and an examination revealed chronic prostate inflammation. I asked her to smoke on the balcony and ventilate the house more. 3 months later, a follow-up examination showed that the inflammation had significantly decreased. If you are still smoking, it is imperative to quit as soon as possible. You can talk to your doctor about using nicotine patches or nicotine gum as a supplement, or try behavioral therapy such as taking a walk or chewing sugar-free gum to distract yourself when you feel like smoke. After quitting smoking, you will see noticeable changes after a week. Blood circulation to the prostate will improve after a month. Inflammation levels will decrease, and after 3 months, symptoms of frequent undurgent urination will decrease. If you don't smoke, try to stay away from smoking environments to prevent secondhand smoke from harming your prostate. No matter your age, it's never too late to quit smoking and avoid secondhand smoke. Habit 4. Never getting a prostate exam. No need to see a doctor if you don't feel any discomfort. Mary, I'm fine. I have no pain or itching. Why should I get an exam? This is the question I hear most often, but it's also the most dangerous thought. The tricky thing about prostate problems is that they have few obvious symptoms in the early stages. By the time you experience frequent urination, urgency, and a thin urine stream, the problem may have already progressed to moderate hyperplasia. After age 60, the incidence of prostate hyperplasia increases significantly. Data shows that the incidence rate for men over 60 exceeds 50%, and for those over 70, it exceeds 70%. Regular exams can detect problems before they begin. For example, a prostate-specific antigen PSA test can reveal prostate inflammation, hyperplasia, and even early detection of prostate cancer. A digital rectal exam allows the doctor to palpate the prostate to determine its size, texture, and the presence of nodules. These exams are painless and easy, taking only a dozen minutes, but they can help you prevent problems before they develop. I've seen too many seniors delay getting a checkup because they were embarrassed to talk or didn't think it was necessary. A 68-old man named Mr. who had never had a prostate exam until he started experiencing urinary incontinence. Examination revealed his prostate had grown to 2.5 times its normal size, and he was experiencing urinary retention, necessitating surgery. Had he been examined 2 years earlier, he could have controlled the condition with lifestyle adjustments and medication, eliminating the need for surgery. My advice to everyone is, after age 60, get a prostate exam at least once a year, including a PSA test and a digital rectal exam. If you experience frequent urination or frequent nighttime urination, get a checkup every 6 months. Don't be embarrassed. Doctors see these as normal health issues. Early disclosure, early diagnosis, and early intervention can help minimize suffering. A practical tool and app to track your prostate health. Many seniors have told me, Mary, I can't remember how much water I drink each day or how many times I wake up at night. I can't explain it to you when I go to the hospital. I recently discovered an app specifically designed for men over 60 called Elderly Prostate Health Assistant, and it's incredibly useful. This app helps you do 3 things. First, track your water intake. For example, if you drink a glass of water in the morning, open the app, click Water Record, enter 200 ml, and you'll have a record. Second, track your urination, how many times you went to the bathroom during the day, how many times you woke up at night, and any urinary frequency or urgency. You can easily mark them. Third, set reminders for physical exams. The app will automatically remind you when it's time for a prostate exam and even help you schedule an appointment. Why do we need to record this? Because doctors need continuous data to diagnose your condition. For example, If you say, I've been getting up more often at night lately, how much more? Are you drinking more or less water? With this record, I can more accurately assess your prostate condition and provide more appropriate advice. This app is free. I've included the link below the video. You can ask your children to download it for you. It's easy to use and incredibly convenient. Habit 3. Eating red meat every meal. I have to eat pork and beef every day, otherwise I feel. Many older people enjoy red meat, believing it's nutritious. However, if you eat it every day, your prostate can become overwhelmed. Red meat such as pork, beef, and lamb is high in saturated fat. Eating too much can trigger chronic inflammation. Saturated fat causes the body to produce inflammatory factors, which circulate to the prostate, irritating prostate tissue and gradually leading to benign prostatic hyperplasia. Processed red meat such as bacon, sausage, and ham contains nitrites that can turn into carcinogens, increasing the risk of prostate cancer and worsening the symptoms of benign prostatic hyperplasia, aplasia, ABP. Our clinical research has found that men who eat red meat more than 5 times a week have a 35% higher risk of BPH than those who eat it less than 2 times a week. Furthermore, after the age of 60, our digestive ability declines, making red meat difficult to digest. Eating too much can lead to weight gain, and obesity itself is a high-minus risk factor for BPH. Excess abdominal fat releases inflammatory substances, further irritating the prostate. This doesn't mean we shouldn't eat red meat, but rather we should limit our intake and vary the types. Eat no more than 3 times a week, with no more than 100 grams about the size of a palm each time. You can also swap red meat for white meats like chicken, fish, and shrimp, as the unsaturated fats in these meats are good for your health and can reduce inflammation. You can also eat beans such as soybeans and black beans, as the plant protein they contain can replace the nutrients in red meat and protect the prostate. For example, you could eat an egg and a glass of milk in the morning, steamed fish and stir-fried vegetables for lunch, and chicken and vegetable porridge in the evening. This provides balanced nutrition without burdening the prostate. Eating wisely leads to a healthier prostate. Habit 2. Excessive abdominal fat and a growing belly. As I get older, my belly gets bigger and bigger, and I can't lose it anymore. Many elders say this, but excess abdominal fat isn't just unsightly, it's also a hidden killer of benign prostatic hyperplasia, BPH. Belly girdle fat, also known as visceral fat, is different from other fat types. It actively releases inflammatory substances such as tumor necrosis factor T and F and interleukin and IL that travel through the bloodstream throughout the body, including the prostate. Long-term stimulation can cause the prostate to enter a state of chronic inflammation, leading to gradual hyperplasia. Furthermore, abdominal fat can affect hormone balance by converting testosterone into estrogen. Excessive estrogen stimulates prostate tissue growth, causing prostate enlargement. Here's a statistic: men with a waist circumference over 100 cm had a 60% higher risk of benign prostatic hyperplasia, BPH, than those with a waist circumference under 85 cm. The thicker the waist, the more severe the symptoms of frequent urination and urinating at night. I previously had a 70-year-old patient, Uncle Ma, with a waist circumference of 110 cm. He woke up 5 or 6 times at night, and examinations revealed severe BPH. I had him take a 30-minute walk daily and control his intake of staple foods and fats. After 3 months, his waist circumference dropped to 100 cm. His urination frequency decreased to 3, and the growth of his BPH slowed. How can you reduce abdominal fat? You don't have to do strenuous exercise. A 30-minute daily walk, square dancing, or Tai Chi can help burn fat. Regarding your diet, reduce your intake of staple foods, such as rice and noodles. Increase your intake of vegetables and fruits, and reduce your intake of sugary drinks such as cola and juice. Even losing just 5 cat ties or reducing abdominal fat can significantly benefit your prostate. Don't think a larger belly is a problem. It's actually quietly harming your prostate. Controlling your waist circumference is protecting your prostate. Habit 1: chronic ignorance of stress, bottling up all worries. Many people wouldn't realize that high psychological stress is the habit most damaging to the prostate, but it's true. In my years as a doctor, I've seen countless elders develop prostate problems due to anxiety and stress over family and physical matters. When you're under chronic stress, your body releases cortisol, a stress hormone. This hormone does two things. First, it tenses muscles throughout the body, including those in the pelvic area. This muscle tension compresses the prostate, causing congestion and swelling. Second, cortisol lowers immunity, weakening the body's ability to fight inflammation. Once prostate inflammation occurs, it's difficult to heal and can eventually develop into hyperplasia. I have a 66-year-old man named Uncle Chen. His son lost money in business, and he was so anxious he couldn't sleep every day. Soon, he developed frequent and urgent urination, making it difficult to sleep at night. HDP revealed chronic prostate inflammation. I told him, don't worry too much. Adjust your mindset first. I asked him to practice the Aikai with his friends every morning and listen to opera in the evening to gradually relax. 2 months later, he went for a follow-up checkup, and the inflammation had subsided and the frequent urination symptoms had disappeared. After age 60, we should learn to diminish stress. You can chat with old friends and talk about your worries. You can also cultivate a hobby, such as gardening, fish farming, or calligraphy, and practice 10 minutes of deep breathing exercises every day. Sit in a chair, close your eyes, slowly inhale for 5 seconds, then slowly exhale for 7 seconds. Repeat several times and you'll feel relaxed. Stress is like an invisible stone weighing down your heart and your prostate. Learning to relax not only improves your mood, but also improves prostate health. Final words. Dear friends, the 10 habits we discussed today are actually quite easy to change. Drink more water, sit less for long periods of time, eat less spicy food, don't hold your urine, don't smoke, get regular checkups, limit your red meat intake, reduce belly fat, relax, and drink less coffee. These are all small things we can do in our daily lives. But it's these small actions, when accumulated, that can protect our prostate. I know changing habits isn't easy. For example, quitting smoking or cutting back on spicy food might feel uncomfortable at first, but if you stick with it for 21 days, you'll gradually adapt. You don't have to make the changes all at once. This week, start by drinking more water, and next week, try getting up and moving around every 30 minutes. Take it one step at a time, and your body will gradually respond, like fewer nighttime waking, smoother urination, and better sleep. If you found today's content useful, please share it with your friends over 60th. Let's protect our prostate and enjoy a comfortable retirement. Don't forget to try the Senior Prostate Health Assistant tab below the video to help you record your health data and manage your prostate. Prostate problems don't just get worse overnight, nor do they get better overnight. They require gradual, long-term management. With the right approach, even in your 70 seconds or 80 seconds, your prostate can remain healthy, allowing you to sleep soundly, urinate smoothly, and live a healthy life every day. Finally, I wish all my seniors good health and well-being and a happy family.